Hi, my name is Grace Reese, and I'm here to talk about cancer. Many of you have probably known somebody or has had a loved one that has had cancer. And my little brother was diagnosed with cancer when he was at the age of 2, so that's why I wanted to talk about this with you guys today. But cancer begins in the cells, which are our building blocks in our bodies that form tissues, and these tissues make up the organs of our body. Extra cells can form a mass of tissue that is called a growth or tumor. And there are two types of tumors. There is the benign tumors. They're not as threatening as the second set of tumors. The benign tumors can be removed, and they usually do not grow back. The malignant tumors are generally more serious. They can be life-threatening, so they need to be removed as quickly as possible. And sometimes they can grow back, though, so that's the bad thing about that. There are 16 most common types of cancer. There is bladder cancer, brain cancer, breast cancer, cervical cancer, childhood cancer, colon cancer, duodenal cancer, which is in the small intestines and the long intestines, hereditary cancer, which can be passed down from family members. There is leukemia, which is what my little brother was diagnosed with, liver cancer, lung cancer, lymphoma, ovarian cancer, prostate cancer, throat cancer, and skin cancer. Some of these risk factors for cancer is just from growing older, growing up with age. Some are caused by viruses and bacteria, also chewing tobacco or drinking alcohol, and certain hormones or family history of cancer. How you can know you have cancer is there could be a certain lump in your throat, there might be a new different mole you find on your body, you have a hard time swallowing, or you have a sore that doesn't heal as fast or as properly. Some treatment for cancer is surgery to remove it. There is radiation therapy and chemotherapy, which is what my brother had, hormone therapy, biological therapy, and stem cell transplantation. Some people think that with stem cell you have to take the life of a baby, but research has found that you have good stem cells in your own body that you could use that could outdo those bad ones. The radiation therapy uses high energy rays to kill cancer cells, whereas chemotherapy is the use of drugs that kill cancer cells, and chemotherapy tends to be a little more harsher than radiation therapy. This is my little brother Christian, who was diagnosed with leukemia. This was him receiving chemotherapy at the age of 2. Usually it is put inside the vein, and that's when he had it stuck in his arm. This is him going under anesthesia before surgery. And it's very important to have a good group support like your church or family members, because it is a tough thing to go through, and so when you have that moral support, it's the best cure for you. Today he is a survivor. He is now 13 years old. He has been cancer-free for 12 years now. Some positive outcomes from this is the Leukemia Lymphoma Society that raises money through marathons and runs. And anyone can be a part of it. There's 5Ks, there's 26Ks, and you can run half a marathon, a full marathon, just to get out there and help raise support to beat cancer. So thank you for listening. I appreciate that.